Providence Medical Center is a 25-bed critical access hospital in Wayne, Nebraska. We've been here since 1975, and we serve the community of Wayne and surrounding communities.
Our philosophy of quality care at Providence Medical Center is to really get everybody involved, and we've really been working on trying to get everybody to realize that they're part of quality.
Everyone has an opportunity to think outside the box. It's something we strive for to improve on every day. Our goal is the best quality patient care that we can provide, and that underlies everything that we do in our facility.
We see patients come into the hospital, all ages, and you can't tell by looking at them what their literacy level is. We want to make sure all patients can understand the information we give them.
They may have years and years of education, but still not understand the health side of the literacy. It's not just about not being able to read, it's about not knowing healthcare in general.
When our health department started in 2002, one of the first things we needed to do was a needs assessment. Health literacy is a fairly easy and economical intervention that we can do to serve a lot of people. The hospitals in our district were, obvious partners.
A small group of us went to a convention in San Diego with the Northeast Nebraska Public Health Department. I didn't even realize there was an issue with health literacy until that convention.
It was such an enlightening experience, and the people that were there were so into health literacy. And it was kind of like a light bulb went off with me to say, this is something we need to do at our facility. That's when we got into getting a committee together and really looking at how we wanted to promote health literacy in Nebraska and here at Providence Medical Center.
It really hooked the Providence Medical Center staff because they saw how important it is.
Healthcare for many years has been using terms and words that are difficult for even some people in the healthcare community to remember or understand. We're trying to simplify that, make it so people can understand the forms they're reading, the things that are going to be done to them, the locations where they're going.
The health literacy team in this hospital is made up of people from about all departments. We bring this group of people together and we look at our documents. We try to write everything to an 8th grade level or below. We use a size 12 font, no smaller than that. We use a lot of white space, bullet points to get our points across. We try to put only the 3 most important points that we want to get across to patients. There are a lot of people that think we're trying to make things dumb. We don't look at it that way.
It reaches everybody, whether or not you're well educated, or if you have some learning disabilities, or if you have some language problems.
Today we have a pretty robust interpretive program, and we have interpreters on call. They do translation of our forms for us. We work with our local clinic and try and make sure that anybody that comes in that doesn't speak English is able to have an interpreter at that time.
Another thing that we have implemented is the teach-back method. Patients need to tell us in their own words what we tried to explain to them. Those teach-backs are so effective in making sure that patients understand what you're telling them and teaching them.
We're still working every day on trying to get better, but people are learning about health literacy and they want to do more about health literacy.
Now, almost every health district throughout the state of Nebraska has a health literacy project. It's a lot of work, but it's so much easier when you have a lot of good partners and everybody chips in and does their share.